Hi, I'm Dr. Jason Cardinale with Dr. C TV. Developing a healthy spine starts when you're young, and it's really dependent on two factors, strength and flexibility. The combination of these two factors can really go a long way to ensuring that you don't have any back pain. Now, your back is comprised of many bones. It's not just one bone, it's many. So you see all these little bumps here? These are all different vertebrae. Now, in between these vertebrae are discs, right? Those are like your shock absorbers of your spine. Now, you have three primary curves to the vertebral column or the spine. So you have your cervical or your neck area, you have your thoracic or your mid-back area, and then you have your low back or your lumbar area. What's really interesting is that when you were born, you didn't have three curves. You had one big curve. So when you were born, you had basically one big C-shaped curve. Right? So picture, and this makes sense because if you picture a baby in the womb, you think of them in the fetal position, they have that big C shape to their back. And when you come out, this is exactly how you are. And the other curves don't start to develop until a little bit later in life. So now picture this, I know this is an adult-sized spine, but picture this as an infant. And all of a sudden, they start to lift their head. And when they lift their head, you can start to see there's some development of another curve in their neck. So that's the development of their cervical curve. Now, later on, months later, when they start to walk, if they were to just stand up straight, you'll notice that the spine is leaning pretty far forward. All right, and that doesn't happen. You don't see children walking around hunched forward like this. So what happens is they start to develop another curve in their lumbar spine, and what it does is it brings the entire vertebral column right above their hips. So again, proper development of these curves is going to be determined by both strength and flexibility. So it's going to be really important that children develop a very strong core. Shoulder muscles are going to be very important, and also leg muscles as well. All of this musculature combined is going to give proper support to the spine. And so in addition to that, you also want to focus on flexibility. Flexibility is going to allow you or your child to have a nice full range of motion. So again, it's the combination of these two factors which really promotes spinal health. Now, what's also important is that you start to pay attention to the activities that you or your child are doing throughout the day, because you don't want to be in the same position all day long. Parents, you may see this when you're at work, if you have a job that keeps you in the same position. Children may see this when they are at school, if they're at one desk, or maybe when they're home and they're always at their computer. So you want to make sure that you're moving throughout the day and starting to utilize different muscles and allow certain muscles to stretch out as well. So developing a healthy spine really does start when you are young. So parents, it's going to be very important that you start to encourage healthy activities with your children at a very young age. You don't want them in a position where they are, again, always in front of a computer, or maybe if they're playing a video game for hours on end in this hunched position. It's really not good for their back. So you want to try to encourage those activities and role model for them. There's no better way to encourage that than by role modeling these activities. And so paying attention to their posture, even though you may not be a chiropractor, but you can still spot bad posture. So paying attention to their posture, paying attention to their activities could really reduce the likelihood of them having some issues in the future. All right, so encourage those kids to move. I'm Dr. Jason Cardinale with Dr. C TV, and we will see you next time.